Alrighty, so thank you all for joining us. Today is the 14th of November, and we're doing some information sharing today about acupuncture. My name is Esley Caldwell with Caldwell Family Wellness, and for the last 14 years or so, we've been helping people just like you restore their health naturally, without drugs and without surgery. And today we are going to talk about the magic of Chinese medicine, how acupuncture can restore your health, how acupuncture works, the quote unquote science behind it. So, before we get to that, so there are some misconceptions about acupuncture. This is a famous picture from the movie called Hellraiser. I have not actually seen the movie, but a lot of times people think that acupuncture is something like this. Or folks think that acupuncture is something like this. And in reality, acupuncture is more like this. So here is a brief sort of working definition of what acupuncture is. The insertion of small sterile pins into specific points on the body with the purpose of promoting healing and eliminating disease by balancing the electromagnetic energy of the body and allow your system to regain homeostasis and equilibrium. So it's all about bringing your body back into balance. And self-healing is a big part of what acupuncture is doing. We're facilitating self-healing. Your body has an amazing ability to heal itself, and we tap into that innate ability. So acupuncture is part of traditional Chinese medicine. It is one of the oldest continually practiced forms of healing in the world today. There are 5 main branches of Chinese medicine: acupuncture, herbal medicine, food therapy, Tui Na, which is therapeutic massage, and then also Qigong, which is therapeutic breath and movement exercises. So in the world today, traditional Chinese medicine, or TCM for short, is a complete form of healing, providing primary as well as specialty care. Most Chinese medical schools and hospitals offer both systems. And in many European countries and several states, TCM is equivalent to Western medicine, and practitioners are considered primary care providers. So in the world today, it's a complementary treatment that works hand in hand with Western medicine. It is also an independent system of healing. So there are a few different theories about how acupuncture works, and we're going to talk about those today. There is the scientific evidence of the acupuncture points and the meridian pathways, and acupuncture is shown to work on multiple organ systems in the body, and it stimulates the release of hormones and neurotransmitters. So there are a couple of foundational theories within Chinese medicine. There is the theory of qi, that there is an energy that animates our body, and this energy is in every cell of our body. It's really the energy of life, but all things have qi. A rock, your cell phone, a coin, there's all some sort of energetic vibration on everything. But in the body, qi is what gives us our life force, gives us our strength, gives us our vitality. And this qi energy flows through pathways in the body that are called meridians. These meridians are separate and distinct from other established biophysical pathways in the body, like your blood vessels or your lymph or your nerves. So the meridians don't correspond with any of those. They influence them all, but they're not a direct correlation with any of them. So this chi is our life force. It is a biomagnetic energy. It is electromagnetic energy. And it's something that you can feel if you bring your hands up in front of your chest, and without touching, if you just move your palms in and out. So you're moving your palms in until they're just a couple inches away from each other, not touching. And then you pull your palms away, and you may be able to feel kind of like a force field between your hands, or like a magnetic sensation pushing back when the hands come close together. So they're not touching, but you can feel the other hand a few inches away from it. Or you feel warmth or tingling or some kind of sensation in your hands. This is your chi. This is that energy in the body. Okay, there is a certain sort of misunderstanding of acupuncture that it is just some kind of woo-woo sort of thing that's kind of out there and sort of mystical in nature. And the reality is that sure, there's there can be a woo-woo aspect to certain things, to anything really. And when we're talking about energy, this is something that, like we're saying with your hands, you can actually feel it with your hands. And then when you really start to think about it, this energy is part of our everyday lived experience as people. Our experience as humans, moment to moment in our life, is a product of energy. And the term energy is part of our vocabulary. You hear, people say a lot of times, like, for example, first thing in the morning, I woke up great. I felt rested. I felt like I had a lot of energy. Or on the flip side, you may say, I didn't sleep well last night. I feel tired. I feel drained. I feel like I don't have much energy. There are energy sort of vibes or vibrations that we feel from other people. If you met your significant other, you may have felt a sort of chemistry, which is an energy sort of vibe that is palpable, that you can feel. There are times where you can go to the same place, the same people are there, but the energy is very different. So, for example, in a church, at a wedding, or at a regular church service, there may be a certain kind of joyous sort of energy. You go there and the same people are there for a funeral, it's a much more somber environment. You could maybe walk in blindfolded and feel and know that there's something different in the energy in that room. So energy is something that is not really all that foreign to our experience as people. It's part of our everyday reality. Sometimes folks have asked if acupuncture is placebo. Placebo basically means that it's a treatment that that works because you think it's going to work. So the patient is sort of in collusion with the practitioner, and they're working together to sort of psychically make things work, even though it's not doing anything. That's sort of a definition of placebo. Having said that, if that theory is true, in order for acupuncture to be placebo, then the person receiving treatment would have to know that what was being done to them is for their benefit. And here we've got Fido getting acupuncture. Fido doesn't always know what the person is doing. You've got this little dog here getting acupuncture. And horses, there has been a real spread of acupuncture being provided in veterinary situations. A lot of vets here in Cincinnati are learning acupuncture really around the world to treat animals at the zoo, like this tiger who's receiving acupuncture. And even reptiles. This sea turtle, small young sea turtle, a couple years old, is getting some acupuncture. So if it's working on all these animals, who can't really, especially when you talk about a reptile, they can't really know what a person, they don't really deal with people that often. If it's working for them, it can work for you. And I have a number of patients for whom taking their pet to get acupuncture was the gateway for them to get acupuncture. They said, well, hey, if I'm taking my dog in and my dog is getting better, then maybe it can help me as well. So understanding the science of what is happening at an acupuncture point. There are points all over the body, over 300 established points, and then a number of extra points. And what they've found, and again, this sort of knowledge is kind of constantly evolving. What they found is that there is a temperature variation at acupuncture points. So 0.1 to 0.2 degrees warmer, that an acupuncture point is actually measurably warmer than the area around the acupuncture point. That's not a point. There's also what's known as galvanic skin response. And this is basically talking about the understanding that our skin has an electrical charge and our skin is conductive to electricity. And so the galvanic skin response is measuring the skin's resistance to electricity. And what they found is that resistance is less at acupuncture points, that there is indeed a greater electrical conductivity at an acupuncture point. So these are two pretty significant ways that science is starting to understand that there is something happening at an acupuncture point. This is another theory called the Primo vascular system. And this is a theory that helps to quote unquote scientifically explain the meridians, those pathways of energy in the body. So this is actually a new circulatory system that is independent of the other principal circulatory systems in the body, blood and lymph. So it's a new system, independent from them, and it's found in and around your blood and lymph vessels, in and around nerves, the spinal cord, the brain, the fascia, and our organs. And this Primo vascular system was discovered initially 60 years ago in Korea. And the person who originally discovered it, put the theory forward, it sort of lay dormant for several years. And then back in 2002, other scientists read the initial articles about the Primo vascular system and decided to try to replicate those results. And then they used some fancy staining techniques. They used dye. And they found that with those staining techniques, using animal and human tissue, they were able to confirm the existence of this Primo vascular system. So it is small, it's microscopic, and it's translucent. So with those microscopes, they're able to see that there are these structures in the tissue. And the theory is that this Primo vascular system is responsible for the electrical activity at acupuncture points and through the meridians. In Chinese medicine and TCM, the meridians are not just lines in the skin, they are 3D. And so in this Primo vascular system, they're tubes, but they actually have a fluid inside the tube, and that fluid contains stem cells and DNA. So this is an important discovery that's shedding light on how acupuncture works, how the meridians work. And there's some other science behind the meridians. We talked about skin conductivity to electricity, but also the acupuncture points. If you you can conduct electricity faster through the meridians into other parts of the body. So you take a certain length of on someone's body from one point to another and run a electrical charge through it, like on a TENS unit. There are ways to measure the speed, and it will go faster than through the same distance off of an acupuncture point. And similarly, you can send a charge from one point to another. So a distal point, those are closer, further away from the trunk, further away from your abdomen and chest. And the proximal points are closer. You can run a charge from one to the other, and it's going to go there, and it's going to go there faster. So in terms of conditions that we treat with acupuncture, foremost among them is pain. And there are sort of three principal mechanisms for how acupuncture is working, what is happening in acupuncture treatments in the body. First and foremost, acupuncture promotes deep relaxation. So there's a profound neurobalancing and calming effect that happens while you're getting acupuncture and after the treatment. It's sort of a cumulative effect, and we'll talk about that more as we go forward. Secondly, inflammation. So inflammation, we're learning more and more about inflammation is the root of aging, it's the root of many diseases, and acupuncture is a fantastic treatment for calming down local inflammation in parts of the body, and then also systemic inflammation throughout the body. And then the third thing is that acupuncture helps to promote circulation throughout the body. So those are kind of three of the main mechanisms. And now when it comes to pain and pain management with acupuncture, there are what are called endogenous opiates. Endogenous means sort of internally created. So these are not like opiate drugs would be exogenous opiates from outside. Endogenous is opiates that are released and created inside the body. And these are the natural painkillers, your feel-good chemicals, endorphins, enkephalins, the hormones, feel-good chemicals you get from after you exercise or falling in love. Those kind of chemicals are sort of your endogenous opiates. So acupuncture stimulates their release. And so these endogenous opiates can actually block the perception of pain. They have a morphine-like effect. And then functional MRIs of the brain show deactivation of pain perception centers. So it's kind of like acupuncture, and these endogenous opiates are flicking the switch in the brain and turning down pain perception. So we mentioned local points earlier. When we're treating local points, what we're doing is releasing tight, shortened spasm muscles back into a resting state. That is also known as trigger point therapy, aka dry needling. Dry needling is a type of acupuncture, for the most part, that is focused on bringing these muscles out of spasm. Local points are also helpful for reducing inflammation. So if someone's got a joint or their back or whatever that is inflamed, doing points that are local to the area where it hurts can help to reduce inflammation. So even if there's not necessarily tight, shortened spasm muscles in that area, we can still reduce inflammation by using those local points. And then the sort of micro trauma of these small little pins being inserted into the area promotes local healing, localized healing. It kind of increases the healing activity that is happening there. And then distal points are points that are in the hands and feet and have systemic effects in the whole body via the meridian system. So there's basically acupuncture, there's two different points, two different types of points we use. Local points are where we put a pin where it hurts, and then distal points are points that have those three principal mechanisms I mentioned of promoting deep relaxation, reducing inflammation, and promoting circulation. The distal points are sort of doing that throughout the body. They do a lot more than that, depending on the application. That said, that's kind of a principal sort of way of looking at those distal points than what the distal points are doing. So when it comes to pain management, acupuncture is causing a hormone and neurotransmitter release and local and systemic anti-inflammatory response in the body. And lower back pain is one of the principal ailments that we work on. And then when it comes to pain, we can basically treat pain anywhere, whether it's chronic pain you've had for a few months, or it's acute pain from, slipping on ice, or just some kind of, a sports injury or acute injury, and then just arthritis, which is joint inflammation. Anywhere in the body, we can work on arthritis, knees, shoulder, hands, feet, neck, and then other sort of issues in different joints like tennis elbow or carpal tunnel or frozen shoulder. These are also things that we work on. Other types of pain that are a little bit outside the box: cancer pain, abdominal pain, post-surgical pain. And post-surgical pain can mean pain like right after surgery, or pain 40 years after surgery and the area still hurts. We can treat both. Obviously, we're not going to use local points if someone has just had surgery. If there's a wound, or there's an incision, we're going to stay away from that area until it's healed. That said, doing acupuncture in other parts of the body can be helpful after surgery to speed the recovery. And then neuropathy is another issue that can be painful. It's not always painful for some folks who have neuropathy. It's just numb. So you're losing feeling. And in some cases, it's numb and painful. And that is something else that we can treat. So acupuncture is very effective at treating stress and stress-related conditions. And similar to pain release, we're working with those endogenous opiates. So promoting relaxation via endorphin release, and also elevating serotonin levels. So serotonin is one of those brain hormones, and acupuncture helps to regulate its level in the body. Acupuncture also has a direct effect of reducing stress hormones. The most common among them is cortisol. And in doing so, it helps to balance your sympathetic nervous system response. So sympathetic nervous system is the fight or flight response. So we're talking about sympathetic versus parasympathetic nervous system activation. The parasympathetic nervous system is what they call rest and digest. That is a more sort of laid back nervous system response versus the sympathetic response. And so acupuncture helps turn off, flick the switch on that fight or flight response, and turn on the rest and digest, the I'm on vacation response. And acupuncture is effective for acute stress or chronic stress. So this is resting and digesting. So some of the ways that acupuncture can help with stress is by improving mood, and then helping to treat stressful mental states like depression and anxiety. So the AcuNap is a common side effect of acupuncture that folks come in and have us put pins all over their body different parts of the body, and they actually fall asleep during the treatment. This happens pretty often. So acupuncture can treat a number of different conditions. And this data is a little bit old. That said, World Health Organization and also National Institute of Health have said there's over 30 different conditions that acupuncture can help with. Our clinical experience may have other issues that we treat that aren't necessarily on their list. So we'll go through some of these issues. Women's health is a major area that we work on. So any sort of issue going on with the cycle. Painful periods, PMS, irregular cycle. These are things that can respond very well to acupuncture. Infertility in men or women. We tend to see more women for infertility. That said, it can help with men also. We do a lot of support for women that are going through in vitro or IUI procedures for fertility. Acupuncture can help increase the chances of the in vitro, like IVF technique, to be more successful. And then later in life, menopausal issues can respond well to acupuncture. Hot flashes, hormonal imbalance issues can be treated with acupuncture. And then we do treat women during pregnancy for different aches and pains that come up during pregnancy, also for morning sickness. And then after the baby is born, there may be postpartum issues, postpartum depression. This is something else that can respond very well to acupuncture. A number of digestive disorders respond well to acupuncture, and especially these conditions, and then also just anything that is autoimmune in nature. Acupuncture may be able to help with that. But Crohn's disease, IBS, IBD, UC, ulcerative colitis, these are issues that the acupuncture can help with. And a few other issues, any sort of stress-related disorder, anything that gets worse with stress, that's a good indication that acupuncture may be able to help with it. Headaches and migraines are a big part of what we do. Smoking cessation for folks that want to quit smoking. Drug and alcohol addiction. So acupuncture can be helpful to reduce cravings, reduce withdrawal symptoms, help manage stress in folks, especially who are in the context of a whether it's in or outpatient drug treatment program. Blood pressure is something else that acupuncture can help with. And then cancer treatments, acupuncture and oncology. We treat the body while the allopathic, the Western medicine, treats the cancer. And we help keep the body going through the side effects of chemo and radiation. So fatigue and nausea and neuropathy can often be caused by chemotherapy. So the acupuncture has a major role to play in oncology. Any side effects of cancer-related medications may be helped with acupuncture. So in terms of how the treatments work, typically they last for about an hour. And after consultation, put the pins in, leave them there 20, 30 minutes. A lot of times we do front and back treatments. So we'll do the same thing on the front that we've done on the back in terms of 20 to 30 minutes of waiting while the treatment is happening. And so size matters. You can fit 20 acupuncture needles into one conventional hypodermic needle. So this is why I call them acupuncture pins instead of needles, because a needle is hollow. These pins, you can even see the one on top is sort of bending. So they're much more flexible and filament-like than the rigid hypodermic needle for injection or giving blood. So babies getting acupuncture. I wanted to talk about cupping therapy. This is a big part of what we do in our practice. If you're interested to read more about cupping, there's a blog post on our website about it. Cupping as a cross-cultural phenomena. We've had patients from probably a dozen different countries that tell me that they had some form of cupping done on them by a grandmother or someone in their family, and so there's a sort of rich history and cultural, medical sort of cultural use of cupping around the world. I've had folks from many different countries, different religions use cupping, and so it's fascinating. And I've learned the word for cupping in a few different languages. In Arabic, it's called hijama. It was in the Quran that Muhammad talked about cupping as being an important therapy to use in healing. So I've had patients that are Muslim or from Muslim countries that have big fans of cupping. In Yiddish, the old Jewish language in Europe called Yiddish, cupping is called bankas. In Ukraine, it's called banki. Those are just a couple of the examples of cupping, but really around the world, there's a tradition of cupping that I just find fascinating. Cupping is also called myofascial decompression or trigger point release. And what cupping is doing is using negative pressure. Positive pressure is when we are pushing, negative pressure is pulling. And so that negative pressure of the cups decompresses the area and lifts up the muscle and the fascia up into the cup to basically create space. So where your muscles are tight, they're spasmed, they're uncomfortable, cupping creates space between them and improves circulation and brings the muscle out of spasm. So it's a form of instrument-assisted soft tissue mobilization. That's a physical therapy term that I thought was humorous, just a long way of saying it. It's a treatment for chronic myospasm, where someone has chronic musculoskeletal pain and stiffness. In Chinese medicine, we also use cupping for some respiratory issues and treatment like asthma. And this is kind of a picture of an example of that chronic myospasm. And stress often manifests as myospasm and stiff muscles. So cupping is a relaxing therapy. Some folks say that it's just like getting a massage. This is an MRI image of a cup. You can see the muscle being pulled up into the cup. This is a cupping on the shoulder. And this was me cupping my son when he was a baby. It's about 4 years ago, 4 years and change. He had a little cough, some respiratory thing going on. So we're doing some cupping on his back to help him with that. This is, we're talking about cupping marks now. Now, little guy didn't get cupping marks. Not everybody gets them, but this is James Harrison. He played for the Steelers for a long time, also played for the Bengals for a year. And a lot of athletes get cupping. James Harrison probably weighs 250, 260 pounds. He's a big guy, and that's why he's getting cupping all over his body. When he gets acupuncture, he's getting probably 60 different pins in his body. Someone who's that big and that muscular, they tend to need a little more therapy than folks like myself who are less muscular, a little bit smaller, and then plus being an athlete, they get banged up a lot, and so this is just a picture to show cupping marks. That is Gwyneth Paltrow. She's on, I think, the red carpet. You can see she's got those cut marks on her back, and cupping marks are not bruises, so they're not. It's not an injury to the body. The marks are indicative of positive changes in healing happening. So when you have chronic myospasm, it is going to constrict the blood flow, and your blood flow is going to thicken. So your platelets make the blood thicken when it's being constricted. And so what cupping is doing is drawing that stagnant blood out of the muscle and back into the skin where it is visible as a cupping mark. So that's just an important thing to understand. So that is all we have for this presentation. Thank you for listening. If you have any questions, feel free to ask. You can unmute yourself and ask, or you can just type it into the chat. All righty, well, if I was that comprehensive, that's a good thing. If any questions come up after tonight, you can feel free to send an email or give us a call. We're happy to answer your questions, and have a wonderful rest of your evening, and we will see you soon. Take care. All right, folks, have a good night.